Good afternoon. I'm Dr. Sandra Martell. I'm the Public Health Administrator for Winnebago County. And today I am solo to kind of go over some of the numbers related to schools and what we've been seeing. So first of all, over the weekend, I want to kind of share some community level metrics. So today we're reporting 63 new cases, but over the weekend we saw 119 cases over the last 2 days. So we're averaging about 60 new cases per day. Our total cases now in the county are 5,244. And the cases that we're reporting today are anywhere between the ages of 6 years and 79 years, showing that this is a disease that impacts both the young and the older age spectrums. Our positivity rate now is at 8% in our rolling 7-day average. And so I don't need to share what that means, that we are really going to have to take a look at some of the things that we're doing. We're reporting some new locations of concern: Morning Star Village, North Point Terrace, and Prairie View Assisted Living. While we have no additional deaths to report, we continue to monitor, and our recovery rate is at 96%. Both of our community-based testing sites are reporting increased volumes of testing, because that's been another question. We talk about how is positivity rate calculated. But that tells me, and should indicate to all of us, that more individuals are symptomatic and are out to get tests. And our 3 health systems continue to monitor their capacity. And while they have capacity, they remind all of us that staffing could be an issue at some time. So while we're considering and experiencing moderate community transmission, we put our schools and our businesses at risk. So today I wanted to share a little bit about where we are at schools. Some of the school districts in Winnebago County have been in session for 6 weeks. Our largest 2 districts have been in session for 2 weeks. Cases of COVID-19 have been reported in over 43 schools, and that's everywhere from our pre-K and 12 up to our universities. So no school level or grade has been spared in all of this. Total cases reported are 69 within the schools, 33 adults, and 36 children. But I want to put that in some context and perspective. Based on the Regional Office of Education, we have over 50,000 students in Winnebago County and over 5,000 teachers. So when you look at that, the numbers are small. So it talks about how well our schools have done, and especially the school nurses. I call them the guardians at the gate. They have been quick to identify potential cases. 1 symptom or more, they're sending children and staff home so that they can be tested, increasing the testing numbers, as well as obtaining an alternate diagnosis. And we believe that that protects our community as well as our school, because we can identify the infections earlier in the course. The number of individuals who have been quarantined, though, as a result of this, are 438. So for every single one of those cases, we've done a case investigation, identified who the close contacts were, and quarantined those individuals. The average age of the case is 26 years. And so if I were to tell you that who the super spreaders are, we know that that's the group has been the 20 to 29-year-olds. And some of the concerns regarding early childhood have not really borne out. And the median age is 19.4 years. So that means we've got equal numbers of cases above the age of 19 and below the age of 19 years. So what's been going well? Schools have prepared and made the necessary changes to prevent the transmission in schools. So while we've had cases associated with schools, they have not been transmitted in the schools. These are acquired infections outside of the school environment, detected in the school, and then appropriately quarantined. So that's why we are not getting the transmission at this time. But it does require all of us to be on board. The school children, I'm going to call them the little kiddos, have been doing a great job. And they've been supported by their families. They're wearing masks. They're staying home when they are sick. They're going to see their health care provider if the child has 1 symptom and the school nurse is calling them to come pick up their child and their siblings to go home until that child either has an alternate diagnosis or a negative COVID test. And they've been working to limit those exposures after school and on the weekends. So again, while we have cases in schools, transmission has not occurred in the schools. The infections have been acquired outside of the school, which is why that community transmission rate is something we all have to own and we've got to work on. Now, the school personnel, I'm going to call them the adult kiddos, have not been following the guidance consistently. They needed to limit in-person meetings. They need to stay home when they are sick as well with one or more symptoms. And they need to avoid mixing the cohorts. Oftentimes, we're having to quarantine more because if the teachers mix a cohort, and we've talked about this before, if I'm a teacher of 20 and you're a teacher of 20, and we combine our classes, if one exposure occurs, now we've got 40 children impacted versus just 20. Off-site school activities have also exposed both children and adults. The weekend getaways, the family gatherings, the social events, and the traveling sports teams and clubs. These are the kinds of activities that we need to be mindful of. We've talked about bringing back to in-person education, but it's the outside activities that are driving this infection in our community, and we need to be mindful of it. So, and the results have been increasing number of contacts. So one case generates a significant number of contacts. We've had increased number of classrooms quarantined, increased number of adult caregivers who must stay at home with the quarantined children. And ultimately, we've had the increased infections. It's also resulting in decreased stability for our paraprofessionals and support staff who rely on in-person education for their employment. If a school has to take what's called the adaptive pause or return to remote learning, that staff that relies on in-person then goes off and are furloughed. And so we have to be mindful that what we do impacts others. And of course, we ultimately talk about the increasing morbidity and increased risk of mortality. We have to be mindful of both. We need to keep our community to help keep our kids safe and our schools open. So a couple of reminders. You must quarantine while you're waiting for test results. I've heard people return back to environment and say, I got tested yesterday and I'm waiting for my test result. You must quarantine at home until your test results are received, because if that test result is positive, you will now expose people over that time frame. All school personnel have to be intentional, thoughtful, and follow the guidelines that the administration has put in place to keep the school environment as safe as possible. That means social distancing. That means cohorting, combining classrooms, or doing what they call the collaborative classroom model. This is not the year that we can be doing that. Wearing the face coverings when you're outside of your classroom in shared office space or classroom spaces. Reviewing the travel guidance. We put this out every Tuesday so that people can make plans accordingly. If you're traveling to an area where the infection rate is higher, think about what you are doing there to make sure that you do not bring the infection back and back from the outside into our inside school environment. Staying home and following up with your school's COVID-19 team if you have one or more symptoms of COVID-19. Do not brush them off. Don't brush off that newly acquired headache, backache, stomach ache. All of those things can be signs and symptoms of COVID. This disease, as we have seen, as we've learned, and as it evolves, this pandemic, is a great imitator. It has lots of different symptoms. And parents and guardians must continue to be thoughtful and intentional and follow the guidelines. Think about your weekend getaways. Think about your family gatherings, the play groups, participation in traveling sports or private clubs, and social events such as birthday parties. I know it's hard. It's a pandemic. We're tired of it, but we are doing well at holding, but all of us in the community have to do our part so that people can stay safe in the in-school environment. I cannot tell you how hard it is to close schools and quarantine. Children need socialization, and any parent who's been doing remote learning with their children needs their children in school as well. It's a hard job being a remote teacher and a remote worker all at the same time. And we know that they struggle when remote learning is implemented. There are emotional and mental health impacts, and there are also economic impacts. We talked about the economic impacts on individuals who rely on schools for their employment, such as the aides, nutrition staff, custodial, bus drivers, office. I'm sure I've missed someone in that grouping, but everyone relies on the schools to be in session for those kinds of paras and support. And our business community relies on our school as well. They rely on our school to make sure that their workers can return to their work environment, that they have a place for their children to be. And it's disruptive to them as employers to have calls that come and say you have to pick up your child, or the next 2 weeks are going to be quarantined and then they're remote learning. And that parent then, or caregiver, is in remote. We've met with our representatives from restaurants and bars to consider what additional mitigation strategies we can put in place. And you can imagine they're not happy about that either, and who can blame them? We're moving now from 3 validated to 2 validated complaints. They want us to step up the enforcement activities on those individuals who may, and entities, we talked about those businesses that may be contributing to the spread. So in addition to the 3 that we reported last week, Choice Furniture has been issued a notice of non-compliance and will be posted on the website. So as we come through this, we have to remember, we say it over and over again, we are all in this pandemic together as a community. We're all in for 815, we're all in for Illinois. If this pandemic has not taught us that we are all interconnected and interrelated, it will be a hard message to get through. So whether you're a school, a daycare, a university, a business, from a small, locally owned to a large big box, bars and restaurants, if you're parks and recreation, if you're a sports club or sports organizer, if you manage arts and museums, if you are a place of worship, if you're a community center, if you're a government, if you're a family, if you're an individual, we are all interdependent on each other to keep this infection spread low. So be intentional and be thoughtful. Wear your face coverings, maintain your social distancing, wash your hands, minimize your contacts, and remember to get your seasonal influenza vaccination. We can do this. We can keep our children safely learning in school, our businesses continue to thrive, and we can continue to maintain a high degree of safety in our community during this pandemic.